Hello everyone. People very frequently ask why is IVF necessary or who are the couples who require IVF? The answer to this question is IVF is an advanced form of infertility treatment and it is offered to the couples who cannot conceive naturally or are unable to conceive with the help of simpler forms of treatment like ovulation induction or IUI. Or the couples who does not fit into this category, that is in whom we cannot even offer the simpler forms of treatment. So these are the couples who require IVF. So let's discuss today who needs IVF. And if you have any queries regarding this, do write them in the comment section and I'll reply to all your queries after this session. I am Dr. Aashita Jain, fertility expert, Bavishi Fertility Institute. Before knowing who needs IVF, let's first know what is IVF. IVF is in vitro fertilization, or in common language what we say is test tube baby. In this procedure, embryo is formed outside the body and the lab, and then this embryo formed is transferred into the female's uterus. Now what is IVF, how it is performed, what are the steps of the IVF? All this we are going to discuss in detail in our upcoming session. So do stay tuned for that. So let's see what are the factors in which IVF is required. First, let's see the female factors. In female, the first and the most common factor is the fallopian tube blockage or damage. Fallopian tube blockage or damage will prevent the egg and the sperm to come together and fertilize. And hence the pregnancy cannot be achieved. And in IVF process, we do this process outside the body and then the embryo formed is implanted into the uterus. The second and the most common is the ovulation disorders. That is the females in which the ovulation is infrequent or absent. Like in females with polycystic ovaries, where the ovulation is achieved with the help of medication, but still they are unable to conceive, or even with medication we are unable to achieve ovulation. So in these cases, IVF is required. Then comes severe endometriosis. Endometriosis is a condition in which the lining inside the uterus, that is the endometrium lining, implants outside the uterus and grow, and thus hampers the function of the ovaries, fallopian tubes and the uterus. Therefore, pregnancy cannot be achieved. So in this case also, IVF is advised. Then comes an age-related infertility. As we have discussed earlier, that as the woman's age advances, her fertility potential decreases. As the female's age advances, her potential to form eggs and the quality of egg decreases. Therefore, they were unable to achieve the pregnancy. So in these patients also, IVF is required. Then comes the tubal ligation. In this procedure, the fallopian tubes are blocked and hence a female is unable to conceive permanently. So in these cases, if they want to achieve pregnancy again for some or the other reason, then besides the tubal reversal, IVF is one of the options. So these are the common factors in female. Let's see what are the male factors, because in half of the cases of infertility, male factor is responsible for not achieving a pregnancy. The males who have very low sperm count, the motility of the sperms is very low, or the quality of the sperm is poor. In these cases, IVF forms a ray of hope for achieving a pregnancy. There are men in whom the sperm count is 0 and the sperms are immotile. So in these cases also, IVF is one of the options to achieve a pregnancy, and more precisely, ICSI is a better option. Then comes the males in whom the sperm count is 0 and the semen is unable to come out. In these cases, or in some subset of these patients, IVF can be used to achieve a pregnancy, because in these cases, with the help of needle or biopsy, the sperm is retrieved from the testes and is fertilized with the egg, and the embryo formed is then transplanted. So IVF can be used in these cases. These are the common male and female factors in which IVF is required. There are certain special conditions also in which IVF is required, that is genetic disorders. If any of the one in the couple is having any genetic disorder which can be transferred to the child, then in this case pre-implantation genetic testing is required, and this can be performed only with IVF. In this procedure, the embryos formed are screened for the genetic disorders, and the one which are free of the genetic disorders are transferred to the female uterus. Then there comes the factor for fertility preservation. The patients who have very severe diseases like cancer or any other health condition, or due to social reasons for which they cannot conceive at present, in these cases, with the help of IVF, they can get their eggs, sperms or embryo freezed, and they can achieve the pregnancy in future with help of these frozen gametes. Then there is a category of patients who require third party involvement, that is egg donation, sperm donation or embryo donation. In this case also IVF is required. These are the patients whose age is above 40 years, or who have attained menopause, or the ones with premature ovarian failure, or the patients who have achieved menopause very early in their life. These are the patients who require IVF. Then there are females whose uterus are unable to carry pregnancy, or they have certain health issues due to which they cannot carry a pregnancy. In these cases, another female is required to carry the pregnancy, and she is known as a gestational carrier. In this technique, female's eggs are fertilized with the husband's sperms, and the embryo sperms are transferred to the other female, who is known as the carrier, and then the pregnancy is continued for 9 months in that female. So this can be achieved through IVF only. So these are the categories and the factors in which IVF is required. And if you fall in any of these categories, you should think of IVF so that you can achieve your dream of becoming a parent. Still, if you have any queries, do write them in the comment section, and I will be happy to reply to all your queries. Thank you so much.